there is a no respiration. So two types of scenario is there. One is no respiration with the carotid pulse is respiratory arrest, and another is carotid pulse not present and no movement of the respiratory chest, no movement of the chest, no respiration is cardiac arrest. So we have to first is call for help. Second thing we have to do the CAB protocol. C means circulation. Start the compression. So what is the area for the compression in the adult patient is lower 1/3 of sternum. So how to detect? This is rib cage. Just 2 finger away from the rib cage. You have to put your, this is the heel of the palm. This is the heel of the palm. Put your heel of the palm in lower 1/3 of the sternum. Entangle with the other hand. Start compressing. 1001, 1002, 1004, 1005, 1000. Why 1000? Because you have to make a gap to recoiling of the proper recoil. 1, 2, 3 you can say, but it is proper recoiling of the lung is made. So 1001, 1002, 1003. So this is first part. You have to start the compression within the diagnosis of the cardiac arrest within the 5 to 10 seconds and start the compression within the 5 to 10 seconds. Timing is very important in case of BLS or ACLS. So start compression like that. Why the fanning of finger? Anyone? Fanning of finger, if the both are entangled, then there is a chance of refraction. So there is a fanning of finger. So pressure is coming from the shoulder and the back muscles. And this is the anterior placed elbow, and pressure is not coming from the wrist or elbow. It is coming from the shoulder and back muscles like that. 1001, 1002, 1003, 1004. So this is start the compression fast. Next, CA is airway. You can give mouth to mouth, or if AMBO is there, you can take the help of AMBO, or you intubate and start the ventilation. So this is the if you airway management, you have to straightening the pharyngeal and laryngeal axis. How? Is just lift the chin. Lift the chin. It makes the if lift the chin, and it can straightening of your airway. Pharyngeal and laryngeal axis should be parallel. Next is A हो गया. Next is B. Breathing is 30:2. 30 compression followed by 2 respiration. 1 second each. How long? You can calculate. But first is the characteristic of the CPR. CPR is 100 to 120 per minute, and its depth is 5 to 6 centimeter or 2 to 2.4 inch. This is your characteristic of the CPR. মানে chest compression rate হবে 1 minute. And it is important because your 2 heart structure is there. If there is a sternum, there is a spine. So 2 heart structure, we have to compress the heart. But the heart is top, so we have to compress it between the 2 heart structure. That's why sternum and lower 1/3 of the sternum. One exception is there. In pregnant patient is middle one, because gravity uterus push the heart to upward. So in case of pregnant patient, it is middle 1/3. All other adult patient is lower 1/3 of the sternum. Next CAB. B हो गया 30:2. How long you can continue?
Up to the
30 to 45 minutes you can continue. In case of pregnancy, it is exception is there. It's only for 5 minutes because you have to deliver the baby. So there is 2 life is there. You have to deliver the baby within the 5 minutes. Next, you start the call for help. Someone get for the ECG. If the 4 scenario is there. One is the straight line. It's called asystole. Another is PEA, pulseless electrical activity. These 2 category will give the CPR and adrenaline. Adrenaline is dose is 1 milligram, 3 to 5 minutes interval is the dose. But if there is a VT-VF is there, then you have to start CPR, give adrenaline 3 to 5 minutes interval same, but you give the shock. Those are the shockable way. If AED is there, then you can put the AED, give the shockable way, the AED can give the shock. But if manual is there, then 120 to 200 joule you have to give for the biphasic. In monophasic defibrillator is there is 360 joule. So those are the criteria for the VTVA. If after the 3 cycle After the 3 cycle, 2 minutes shock, 2 minutes shock. So after the 3 cycle, if this VTVF not normalized to the normal wave ECG pattern, then you have to give the amiodarone or lidocaine. Dose of lidocaine is 1 to 1.5 milligram per kg weight. Second dose is half of that. In case of amiodarone, dose is normal amiodarone dose কত? এটা তো দেওয়া হয় 300, 150 is normal dose, but in ACLS it is 300 milligram. Second dose is half of that, 150 milligram. So after 3 cycle of the shock, you can give the amiodarone or lidocaine. If amiodarone is not available, the second choice is lidocaine. So this is a part of ACLS.
মানে সেটা যদি মানে VT বা VF হয়,
VT by VF, but if there is asystole or PEA, only CPR and adrenaline. This is the right. Now what are the treatable cause? You have to treat the cause also, because it is 5H and 5T. What is the 5H? Hypoxia. First is hypoxia. So you have to treat the hypoxia by putting the patient in the BiPAP or ventilator, or there is a type 2 respiratory failure is there, you put the patient in the ventilator or BiPAP ventilation. So treat the cause. If hypovolemia is there, you have to give the crystalloids or blood products. If there is hyperkalemia is a major cause of cardiac arrest. So 3.5 to 5.5. So correction of the hyperkalemia by calcium 25D with 10 units insulin. So it makes the potassium into the intercellular one. Another is important cause of, in case of children, hypothermia is a cause. It can cause arrhythmia, and it's basically below 6 years. Next is 5.